Hello, I'm Matthew Weinstock with Hospitals and Health Networks, reporting live from the 26th Annual Rural Healthcare Leadership Conference in Phoenix, Arizona. We've heard a lot at the conference about the impact health reform is having on rural hospitals. And as hospitals are trying to adjust to this environment, boards of trustees are becoming asked to do much more and become more proactive in managing that transition. I'm joined now by Todd Linden, President and CEO for Grinnell Regional Medical Center in Grinnell, Iowa, to talk about the role of the board in managing their organizations through this transformation. Todd, thanks for being with me.
My pleasure, Matthew.
So we've got 600 plus rural hospital executives and board members here. You've got some board members here yourself. What's the role the board plays in managing hospitals through the transition, and how educated do you think they are in what's going on in the field?
Well, it is a new record attendance, and I think about 30% of the folks here are trustees, and that's exciting because I believe trustees are going to need to really lead the transformation. This is something that the governance is particularly well suited for because they can also really reach out to the medical staff. So the integration's the key. If we're going to move to paying for value from our current fee-for-service system, the integration with our medical staff is going to be critical. And I think the board is in a unique position to reach out to the medical staff in a way that sometimes management can't. And I'm excited. We have 6 board members here, including one of our physician board members, and that's the buzz right now. That's talking about how do we really engage our medical staff.
What gives the board that ability to speak to the clinicians more so than yourself, perhaps?
Well, I think it's just you can bring a different lens to it. I think the board clearly is the community. The board represents the community. And so if there's a place where there's a little rough water between physicians and hospital leadership because let's face it, it's going to be a food fight in terms of resources. So if we're going to really collaborate, I think when the board says, this is what's good for patients, this is what's good for communities, let's make sure that the medical staff is coming in at this highest level. I think it's the board that can really help bring them to the table.
And how well educated do you think boards in general are about what's going on in the field? Not just the Affordable Care Act, but all the changes we're seeing from mergers to affiliations.
It's complex as it is. But when you start talking about fundamentally changing the way we do what we do, I think we've got a big learning curve ahead of us. I know I spend all my waking days thinking about this stuff, and we've got trustees that obviously have day jobs and come into the medical center traditionally once a month or so. Well, now we've got to connect with our board members in totally different ways, through our portals and other ways, so that they have access to information between board meetings and opportunities to come to conferences like this and state association meetings and others. And I know our board members are just engaging in the certification process, which involves a robust sort of educational model. We actually created a trustee organization and education committee, so our TOE committee, and it's specifically working at what are the education points we need to focus on for this year, so our board's really focused on the most important things, and clearly this transition's at the top of the list.
And so is that a key role for you and for your peers, your executive peers, that you've got to act almost like teacher to the board at some level?
In some respects, we're teachers, yes. Our jobs ultimately are put our boards in the best position to make good decisions. But there's also that other role where our boards need to be our guides as well, saying, look, this is what the community needs. It needs to have access to high quality care. It needs to be affordable. We've got to organize ourselves in a way that will really make that happen. And so tapping into that expertise of the board, both being the beat of the community, but also the collective wisdom. So I think boards need to focus on identifying people that are going to make the commitment to really go beyond what we've done in the past in terms of trusteeship.
And to a certain level, board members come from industries that have already gone through a transformation of one level or another, right? Absolutely. So that's got to influence how they react with you.
Absolutely. I know as we look around our board table, whether it's bankers and the transformation took in the banking industry or insurance, we have an insurance executive, retired insurance executive on our board. Those are very rich nuggets that they're able to share as we think about really remaking ourselves.
I'm going to switch gears just a little bit, Todd. You're a tweener hospital, not a critical access, not a full-fledged PPS, urban center. There's a lot of talk in Washington, the budget austerity talk going on. How's that impacting the tweener hospitals that are here and across the country?
We've suffered in terms of financially, depending on where you are in the country, but in general, tweeners are not a good place to be because you don't have the cost plus reimbursement of the critical access hospitals, yet you're competing with them in many cases. Most of the hospitals surrounding us are critical access hospitals. We're not a rural referral center or, as you mentioned, an urban or suburban hospital, and so we still have a pretty high dependence on government programs, Medicare and Medicaid, and we just don't have that ability to spread those costs to the paying private payers. So it has been a challenge. What's going on right now is really exasperating that. We received about $600,000 a year in TOPS payment, so the transitional outpatient payment, and really weren't expecting that to go away. It does say transitional in the name of it, but that is about $600,000 that just overnight evaporated out of our budget. We're just barely getting keeping our nose above water, and so that's a problem. Then you throw on top if we're going to get a 2% across the board cut or sequestration kicks in, it's going to be a challenge. People talk about operating at Medicare levels, but when you're a tweener hospital and you're operating at about 70% of cost payment for Medicare, compared to, in general, across the country, the high 80s or low 90s in terms of cost-based payment or connecting to that, it's a big challenge.
So that pressure of becoming more efficient, maybe even finding some partnerships, is really going to be on those tweeners in the next couple of years.
I think it has been for years, and that, frankly, if there's a silver lining, it's that. We have, for mere survival, we've had to become much more efficient. We've had to think about keeping people healthy in the first place. We've had to make those relationships, those collaborations with physicians really work, and so consequently, we look pretty good on the quality scale, on the efficiency scale. If those things truly start to be rewarded, that's where there's a lot of hope and optimism.
Lastly, Todd, I want to ask you, you've been walking the halls here the past couple of days. Just what's the feeling of your peers that you're hearing?
Even though there's big challenges, there's a sense of optimism. There's a sense of, okay, we can do this. We're resilient. We're rural folks. We make things happen. And so I think even though there's challenges to boot, we also have I think, ability to make the changes we need to and to do right for our communities.
Well, great, Todd. I appreciate you taking some time today.
Thank you. It's my pleasure.
And I'm Matthew Weinstock for H&H Daily, reporting from Phoenix, Arizona. We'll have our last report from the Rural Healthcare Leadership Conference in tomorrow's H&H Daily. Thanks for tuning in.